All right. All right. So today's webinar is a chance for us to share findings and recommendations from the recent Race Counts report toward identity and visibility, 100 million SWANA Californians strong. It will also be an opportunity for you to hear from organizations on the front line supporting California, Southwest Asian, and North African, or SWANA Californians, also known as Middle Eastern or North African, or MENA Californians. So today, you're going to be hearing from myself, Matt Trujillo, the Director of Strategic Initiatives at Catalyst California, as well as my colleague, Layla Farouzan, Senior Manager of Research and Data Analysis at Catalyst California, along with Dr. Sophia Armen with the Armenian Action Network. Dr. Armen is the Executive Director of the Armenian Action Network, and Amin Nash, the Policy and Advocacy Coordinator with the Arab American Civic Council. So today we're going to be providing a brief overview of the Race Counts data platform, which provides the underlying data presented in the report that we'll be diving in deep into. For that deep dive, we'll be providing information on the report's key findings, followed by some community reflections. We'll then talk about the Count MENA In campaign and close out with a brief overview of the various resources on the Race Counts website, and then close out with a Q&A. If you have any questions, you can submit them via the Q&A function, and we will respond to questions at the end of the webinar. All right, so let's jump into Race Counts. Race Counts is a data tool that provides racial disparity data to support racial justice advocates working on policy and systems change. The tool includes data across 7 issue areas: democracy, economic opportunity, education, healthcare access, healthy built environment, housing, and safety and justice. Each issue area has data from multiple indicators within it, with the tool having a total of over 40 indicators. We share data at the state, county, and city level. So Race Counts regularly releases reports that uses its underlying racial disparity and racial equity data, including the Toward Identity and Visibility 1 Million SWANA California Strong report that we'll be focusing on today. So at Race Counts, we believe that data is an important part of building power and advocating for change. Data can uplift the inequities that communities face and can be a powerful tool in communities' efforts to identify and fight for solutions to these inequities. It's in that spirit that we developed the Toward Identity and Visibility 1 Million SWANA California Strong report that shines a light on the inequities that California's SWANA communities face. And so I'm now going to turn things over to Dr. Armen, who will share more about why a report like Toward Visibility and Identity 1 Million SWANA California Strong is so important. Dr. Armen, over to you.
Thank you so much, Matt. We so appreciate being here. I just want to give a huge thanks to the organizers of this event and to all the community who's here and to the generations that got us here, because we have to say, it's been a long time coming, and this is a triumph and a celebration. This report is absolutely incredible and built on the legacies of decades of organizing and advocacy and community services. And so first, I just want to take a second to just say a huge thanks. I think this is so important. Secondly, one of the reasons why we are so overjoyed, those of us who are working in community organizing, advocacy, services, is because this SWANA report coming out of Catalyst, California is one of the first of its kind ever. And I want to say this because it's really marking what I hope is absolutely a new trajectory, the beginning of many more. So we want to thank Catalyst California for being at the forefront of releasing this type of data. So just quickly, because we're going to get into it deeply throughout this event, the importance of this report is it is bringing visibility, it is bringing validation, it is bringing our lives onto the page. And this report is about giving SWANA people right, a voice to show our experiences in California. The most important thing, and I want to emphasize this, and one of the reasons I was asked here today, is to know that this has been a community effort, a community partnership, and that the term SWANA itself defines many diverse experiences, Southwest Asian and North Africans, including in California, people's immigration histories, people's stories. And this SWANA report in particular's definition, which folks will expand on, really helps give a more diverse look of even what we think of SWANA communities, right, in history, or how we've been portrayed in, whether it's Hollywood, history books, or even in the lack of data. So I want to say we are so thankful because this is really a groundbreaking report. It is something that is paving the way and bringing visibility to a community long ignored, and I will just say long systemically erased.
Thank you, Sophia. So I'm now going to be turning things over to my colleague Layla, who will speak more to how we define SWANA in our report. Layla, over to you.
Thank you. And thank you to Sophia for your kind words. I'm equally excited about this report. It has been a long time coming. So I'd just like to say first that, our research and data analysis team here at Catalyst California worked on better understanding who makes up the SWANA community for well over a year, so that we could create these new equity statistics for SWANA Californians. And as I'm sure most of you know, the truth is there is no one universally agreed upon definition. And, we wanted to make sure we were getting it right. And so as a result, we are basing our data definition of SWANA on two things: one, availability, and two, community input. So that means, what data is actually available. And then as far as community input, there were many conversations with our partners and other researchers across the country, actually, but especially focused on California, of course. And so now I'd like to share the definition as it stands, though it will evolve as all of our understandings and methods will and have. So we do review data availability for SWANA folks annually, and we work with partners to update that definition each year. So it's in progress, and we hope to see a lot more in the future. So there is no race or ethnicity response yet for SWANA in federal or state data collection, which results, in a lack of data, and what little there is available is inconsistent, again, because of that, question around the definition. For our purposes here, we are using the Census Bureau's American Community Survey responses around ancestry as our basis. And that is because the American Community Survey, or ACS, is one of the broadest and most reliable data sources available, and is something we use widely in race counts already. And so looking at that list, we see that some of the ancestries are, it's a varied list, right? Some are more kind of ethno-religious groups, some are nationalities, some are regional, et cetera. And it's, important to note that this list contains the terms the Census Bureau uses. These aren't the terms that we necessarily use or prefer, and that some may be outdated or not the terms that communities prefer. And some may also just be missing, right? Let's see. And I just, we do use this definition, again, because of the data availability and through the conversations with our partners. And we want to be, transparent about who is and isn't represented in our analysis, again, even though some groups may be missing. And when we analyze the data for SWANA communities, we do include SWANA people who identify as Latinx as well, or folks in addition to, SWANA who identify of any race, right? Since there is no race or ethnicity response for SWANA folks. And then the last thing I'll say is that these ancestries, again, make up the basic definition that we use across our analysis for race counts. For example, we have indicators from the ACS like connected youth, and we also use this as a population base to calculate rates for SWANA folks. However, data sources vary, so some indicators may have a slightly different definition, And on the slide, you'll see the breakdown for detailed race Asian, where we have pulled out South Asian groups. We then combine those South Asian groups with the SWANA population to create a SWANA plus South Asian category. And this is used in our police stops analysis because law enforcement agencies report the data for SWANA and South Asian folks together as one group. And you can find out more about our race and ethnicity methodologies by visiting the link on the slide, because there are so many variations, not just for SWANA folks, across the many indicators we have for race counts. And with that, I will pass it back to Sophia for more perspective on that. Thank you.
Yeah, absolutely. Thank you so much. I think one of the things that is really exciting about this report is it's taken, years of organizing, years of advocacy, years of data, right, and research. And it's really looked at how can we try to work with the community and really give as much representation with data available, right, at this time, while also giving us the kind of data that then lets us advocate for more. One thing I just want to emphasize, because we know that SWANA as a term has been popularized, especially in the last decade, in a really, really exciting way. And I also want to say the reason for that has been because of the work of community. And actually, we can locate the beginning of the kind of popularization of the term SWANA, even in a community organizing campaign that was about data. It actually started in the University of California. And I just want to shout out Nairi Shirinian, who's actually part of our leadership team at Armenian American Action Network, who was part of an early SWANA checkbox campaign at the University of California, where she led the creation of a SWANA checkbox, particularly for this data. And so I want to say part of the exciting part of Catalysts, not only SWANA definition, but this SWANA report at large, right? It's built on these legacies, but it also now pushes them forward. So we're really thankful to Catalyst in the ways that you all have really looked at what is the current landscape, right? What do we have available as a way and tool to think about how we're using data to push for more. And I will just say, as we continue this webinar, one of the best parts about those of us who are data obsessed nerds who love it for both advocacy, community resources, direct services, understanding our issues, right, is that we want more and more and more. We want even more disaggregated data, right? We want even more issue breakdown, community breakdown. And so what we do is we build upon them. And so I really want to thank Catalyst for the level of intention in really reaching out to community partners, being within the community landscape, both on the institutional side, the academic side, and also just on the ground to produce what we have in this SWANA definition.
Thank you, Sophia. We'll be going back to Layla, who will share more about the methodology for the report.
Yes, thank you. Yeah, and we have tried to be very intentional, and we have, I think, developed a really strong methodology here in collaboration with our partners and folks in the research space. And so now I would like to share the methodology and limitations, unfortunately, that we faced, but we have basically relied on 3 methods to analyze the data about SWANA folks that, to our knowledge, have not been explored in this depth before. So our process included researching the existing SWANA data landscape, developing the draft methodologies, given the data that we have, sharing the methodologies with SWANA serving and SWANA-led organizations, and then integrating that feedback and kind of finalizing things that way. So the first is just to simply report the data for SWANA people that exists already. So these indicators include asthma prevalence, people who got help for mental or emotional or alcohol drug issues, perception of safety, and usual source of healthcare. And so all of those indicators come from the California Health Interview Survey, which started publishing SWANA data with their 2022 release, which is great. We also have SWANA and South Asian data combined for police stops. And then we have low birth weight births, which is from the CDC. And so that data set is also unique in the sense that the SWANA data available there is only for foreign-born SWANA birthing parents. And then our second method was to calculate data for SWANA people based on ancestry. So that goes back to that list of ancestries on the previous slide. And so this would be our American Community Survey, or ACS, indicators. So those include connected youth, so that's youth who are in school and or employed. We have people employed as officials and managers, housing quality, and then people earning a living wage in that category. And then the last is what we call is calculating data based on weighted average of exposure for SWANA people. And so this is a method that we had already been using for some of the indicators that are not available cut by race. And by using this method, we're able to get estimates by race. And so we've now applied that same method to calculate statistics for SWANA folks. And these indicators include access to green space, exposure to drinking water contaminants, exposure to environmental hazards, and exposure to toxic releases from facilities. And so with that said, the limitations are, first, of course, there's a very limited amount of data available even using these three methods, right? So in particular, we don't have any SWANA data for any of the education or democracy indicators on race counts. And then, overall, we were able to calculate SWANA statistics for 14 of the 47 race counts indicators, though we're always working on improving that. And, second, there are inconsistent definitions of SWANA, right, which can lead to some difficulty in questions about reliability and also comparisons, right, between indicators and things like that. And then lastly, there are small sample sizes in survey data pretty much across the board for SWANA folks, which means that SWANA estimates are primarily available at the state level and only for a few of the most populous counties and cities. Next slide. Okay, so now that we've taken a look at the methodology pieces, we can look at start looking at some of the data. And this is what we have found, again, using that American Community Survey data as far as SWANA communities in California. So we know that, just first off the bat, we know that a lot of these are probably undercounts for various reasons, could be, language barriers in terms of surveying, things like that. Could be fears about, being documented in a government database based on, experiences in ancestral countries, or because of the targeted surveillance in the US since 9/11 and many other reasons, right? But even so, we do know, based on a different data set, which was an experimental census data set, that California has the largest SWANA population out of all the states, and actually having twice as many SWANA residents than the state with the next largest SWANA community. So, and that's even in spite of the fact that that experimental data set excluded Armenians. So as a reminder, just to say, our data does include people with Armenian ancestry, and so that is reflected on this slide. So, as we say in the report, there are, nearly 1 million SWANA folks in California, which represent about 2.4% of the total population of the state. And that's similar in size to the California American Indian and Alaska Native community. And on a more local level, we can see that, maybe not a surprise, LA County and LA City have the largest SWANA populations. And still, though, there are many more counties and cities with substantial but smaller SWANA communities across the state as well. We do see on these lists, counties and cities in the Bay Area, as well as Orange County, San Diego County. And I think based on the chat, what I'm seeing here, I'm very happy to see we have folks from many of those places and beyond on the webinar today. Okay, so now we can move on to some real findings around our race counts indicators. And so while, again, most of the data that we do have for SWANA folks is at the state level, again, due to those small sample sizes for county and city data, it doesn't mean that we, didn't learn more about the inequities faced by SWANA folks in those counties and cities with larger SWANA populations. So starting in LA County, we found that SWANA residents are the least likely to get help for self-diagnosed mental, emotional, or alcohol or drug issues. And this can point back to, many things, including potentially poor access to those types of services, stigma around those issues in the community, among other causes. In Stanislaus County, we found that SWANA youth were the least likely to be connected, meaning in school and or employed. And again, this could point back to things like harsh school discipline policies that school staff disproportionately apply to SWANA youth, right, resulting in school pushout. Though we can't know for sure because the California Department of Education does not report data for SWANA students. They are put into, other race categories. So that's just one example of why we need public agencies to start collecting SWANA data. And then lastly, I'll just point out that in Orange County, we found that foreign-born SWANA birthing parents are the second most likely to have a baby with low birth weight, which again could point to poor access to maternal health care, potentially low quality or lack of culturally competent maternal health care, among other causes. Okay, and with that, we can move on to our state level findings. So first, we are going to look at a special indicator that is in this report, but does not appear on racecounts.org yet, though we are working on it. But, we and partners felt it was important to include in this report. And so, during the first Trump administration, the US saw an increase in reported hate crimes. And given the president's divisive rhetoric and policies directed at the SWANA community, including the Muslim ban, the SWANA community is the target of many such crimes. And following the escalation of violence in Israel and Palestine in October 2023, there has been a heightened level of anti-Muslim, anti-Jewish, and anti-Arab violence, which of course particularly impacts SWANA communities. And in fact, a 2024 report by the Council on American Islamic Relations found that in the previous year, they had received their highest number of anti-Muslim hate complaints in the organization's history. So looking at the data, we do see that people reported more than 4,000 hate crimes against specific subgroups of SWANA Californians between 2001 and 2023. And that's according to the California Department of Justice. And the majority of those hate crimes included a most serious bias against Jews and nearly 1,000 hate crimes directed towards Muslims and Arabs. And, we just want folks to remember that these numbers are known to be severely underreported due to fear of retaliation, potentially lack of knowledge around how or where to report, among other reasons. And so it's really important to look at varied sources. And so as one example, we reviewed, there was a report from CARE California's chapter in 2023, which found that, compared to other students, SWANA youth reported higher rates of bullying along with East Asian and Black or African students compared to other students. So it's important to, use multiple sources and also just know that, data isn't the be all and end all every time, right? There are community experiences, and this is a complement to that. It's also important to note that, what data sources like the California Department of Justice categorize as, anti-Muslim or anti-Arab hate crimes, can target SWANA people of any religion or ethnicity, as these crimes are rooted in, racialized perceptions rather than self-identity. And so in this way, hate crime data reporting can reflect the mainstream homogenization of the SWANA community that we see sometimes. And keeping in the, safety and justice issue area, we'll look at, police stops. And, this is rooted in many ways in the post 9/11, kind of over policing and surveillance of the SWANA community. And we have now added data from the California Racial Identity and Profiling Act, referred to as RIPA, to race counts. And that data set reveals that about 112 SWANA and South Asian drivers are stopped for every 1,000 people in that group, which is more than the state average. So this means they're more likely to be stopped by a law enforcement officer than the average Californian. And, again, this inequity was only revealed because there was a proposition passed to require this type of data collection and annual reporting. And without this data, this type of targeted discrimination was not quantifiable, right? And in many instances, if without quantifiable data, it's easy to dismiss community concerns, unfortunately. And I also just want to point out one thing that sets this data apart from most other indicators is that race is identified by the officer, not self-identified, like for most other indicators. And so, again, that can have, an impact on what this indicator looks like versus some others that are self-identified. Okay, next, I am going to talk about some inequities that relate to our healthy built environment issue area. And we did find some of the largest inequities for SWANA folks in this area. So along with Latinx Californians, SWANA Californians are most likely to live near hazards monitored by the State Office of Environmental Health Hazard Assessment. And these types of sites can include Superfund sites, state cleanup sites, military sites, and others. And this basically means that SWANA folks are among the most vulnerable to toxic substances that can escape these sites through the air, water, wind-blown dust, things like that. And this same pattern actually holds with drinking water, right? So along with Latinx Californians, SWANA folks are most likely to live in areas with higher levels of drinking water contaminants. So that means SWANA Californians are among the most vulnerable to water contaminated with chemicals or bacteria from sources such as factories, sewage, runoff from farms, and things of that nature. So taken together, these higher exposure levels to environmental toxins can result in health impacts for SWANA folks. Things like heart, liver, or kidney problems, cancer, asthma, and other conditions. And it's really important that we can identify and measure these inequities so that we can fight to get these hazards out of SWANA communities that are impacted. And then lastly, I just want to talk about an example where SWANA folks are doing, relatively well in California. And so fortunately at the state level, at least, SWANA Californians have, relatively better outcomes on usual source of care. So that means they're the second most likely to have a usual source of healthcare. And so that's a good thing for the community and could be related to, many factors, things like maybe being more likely to have a job that provides health insurance, right? Among other things. Still, we know that access to healthcare means having, a regular place to go, like a doctor's office, an HMO, a clinic, things like that. It doesn't mean that healthcare is culturally competent, that it's high quality, or that it's affordable for folks. So if you remember, we shared earlier that in Orange County, SWANA foreign-born birthing parents are the second most likely to have a baby with low birth weight. So, that's indicating maybe a disconnect between having a usual source of care and health outcomes, right? There are many things at play. And, to that same point, we know that there are many determinants of health, and that includes things like a healthy environment, right? And again, we did see that there were a lot of inequities faced by SWANA folks in relation to healthy built environment and exposure to environmental toxins. And with that, so now that I've kind of given you a very big overview of some of our key findings, I'd want to turn it back to our partners to share some community reflections and community insights into those data pieces. Thanks. So I will hand it over to Amin.
All right. Those are really, I just want everybody to think about those data points and look at all those factors, because some of those data points in the SWANA, the impacts of SWANA folk, we've never seen before. And that's something I really want to reiterate and kind of point out to the audience, is that, having some clarity to see that SWANA folk, a lot of SWANA people will live next to factories. They'll live next to these runoffs of farms, and they don't realize that they're living next to what's called an environmental hazardous place, right? And they're breathing this air, which is something that we've seen in recent times, especially, I'll just start off by talking about the wildfires, right? The wildfires and its impact on the Middle East North African community. Specifically in the San Gabriel area, there's a high concentration of MENA folk in that area. The residual impact because of these wildfires and the residual impacts that happens with these, the soil and the area they live in, the air they breathe, heavily impacts the community. So seeing this type of data is really important to kind of clarify this, what many SWANA people are living, and also to kind of allow them to point to it, some data points and say, look, we do live next to these. Let's make this a reality. I kind of wanted to talk about some anecdotes too that was kind of revealed in the data points, specifically when it comes to the mental health, the access to mental health, and also some stories from the field with Orange County and San Diego. You know, and here in Orange County, uh, the Arab American Civic Council and a bunch of other groups we often work together when it comes to public health and these initiatives to conduct surveys for the community. And recently we did a survey that found that members from the Middle East, North African community tend to live in multi-generational housing. Uh, but still, when they live together in these houses with their grandparents or with their great-grandparents sometimes, uh, some of these members still feel at risk for homelessness. And when they're reporting these data points in Orange County, these type of factors, do impact, it correlates directly and impact the community's mental health status. So when we're talking about their mental health and issues that are impacting them, these are the unseen things that we're seeing for their access or their needs to get services. There's also the minor impact, or not the minor, but the uh, uh, unseen impacts from trauma, from war, from domestic bullying that these impacts are, or these community members are bringing into their households. And though they might have access to doctors, or though they might have access to other mental health services, there's data to show and there's anecdotes that we hear where Arab Americans and Iranian Americans are heavily impacted by lack of access or by these traumas that are put onto the community. And without this standardization, without having the standardization of an ethnic category, public health services fall behind. Many of the community members can't afford going for Kaiser, can't afford getting a private mental health servicer to really look into their needs. So they rely on public health resources just as much as the rest of the community. But without that categorization or without that recognition, they're left behind. Another thing that I do want to point out, some anecdotes that are prevalent with the community is an example for healthcare in El Cajon, San Diego. El Cajon is the city with the highest concentration of Arab Americans, specifically Iraqi Americans, across California. And there's been a lot of data and a lot of reports that kind of correlates with what Layla was just talking about with SWANA communities. And one thing to point out is that the community during COVID-19 were going to the hospital regularly, but they were also they had a less risk of dying. So that means they had a high risk of getting COVID-19, but also they had low chances of passing away because of COVID-19. And that's because of what many people in the community will say. They have close-knit families, they live in multi-generational households, they like to go to their markets and get their foods that is ethnic food that tends to help them. However, what we're not seeing is that many of these community members who were going to these hospitals, especially the Iraqi community, 75% of them were likely to be on Medi-Cal. 75% of them were actually likely to be on welfare provided by the government. And the question is, why is this community in El Cajon? What kind of environment they're in and what kind of opportunities is around them that leads them to rely on some of these welfare programs, or when they are being supported by their families, what are they not being supported by when it comes to the government? And I think that just goes to show that the community has to rely on themselves, and they have to rely on their support within closed doors and within family members, because it's just they're not being recognized outside of that. The realities aren't being represented outside of their homes, and the broader city and the broader public doesn't recognize them. So I'll kind of wrap up with that, but I do want to point out that many of the impacts that we're seeing with the lack of SWANA data kind of goes, or many of the impacts we're seeing because there is a lack of SWANA data really comes down to what is the civil rights of the community, right? Why are they not being recognized, and why are, as a civilly engaged community, why aren't they being represented? And I think that does impact overall their rights when it comes to services at the borders, services when they're just trying to apply for different jobs, and just how they're perceived. So I'll end it at that. And I think with that, I'm going to be handing off to the great Sophia. I'll always say.
No, and thank you to the great Amin, who I want to be when I grow up. All right, so I just want to say absolutely co-sign everything Amin said. And I really want to emphasize, like, wow, this data, when we first got it, I think the word that came to my mind was, it was so affirming, because we feel these issues in SWANA communities all the time, but to actually see it and to see really the gaps that are exposed in this report actually reflected in the data, it is exactly what we have been talking about for so long. And so I think about this report and data in general, when it finally addresses SWANA communities, as a tool in our toolbox to tell our stories in a different way, to make very real material change, to change the conditions, right? We need to see graphs like this in 10 years that look a lot better. So that is the first community reflection I want to offer, is now we know where to fight and how to fight, because both our stories and the data matter. And data is just about telling the story in a different way, especially in a way that speaks to those in power, so that we can fight. All right, so I'm going to give folks a couple just quick other examples around how we have been reflecting on the findings of this report. Everything from mental health that Amin mentioned, right, to the kind of hazards. It's alarming, to be honest, the gaps in the data, just how far, some of these equity and disparities look. And I want to give a couple just stories about impact in other parts of California. So for one, the wildfires, as Amin mentioned, were a great visible time, right, to describe what happens to our communities and how they live. And we know that something like a climate catastrophe or a natural disaster, right, is kind of in the headlines for a little bit, but the impact on the community is generational, is years. And so our community had, the SWANA community itself, even just here within Altadena, right, within West LA, we had a masjid burned down and an Armenian community school burned down. Those are community institutions that have taken quite literally hundreds, if not thousands of people, right, to build. And those things have impact on people's mental health and their physical health. Those environmental hazards are felt also in California's Central Valley, who has some of the oldest, SWANA communities in this state, who we see every single day as people who are organizing in the community, working with folks, persistent health issues around being around environmental hazards and waste, everything from asthma to the ways that people are living, their quality of life. And, that can be from everywhere from, Assyrians, folks in Turlock, Modesto, right, Fresno, working in highly agricultural, producing spaces, right? They're exposed to really poor air quality, and this data helps give us part of that story to finally be able to tell and say, we need to learn more, because I see a red flag right here. Secondly, another example I just want to mention is, the police interactions, I think, are very, very real. And as somebody born and raised in LA County, I think it is a long invisibilized and understudied part of SWANA history and SWANA experience, especially within our county. I want to say, in a very personal way, many of us were part of early kind of Black Lives Matter Los Angeles organizing, right, around police interaction, especially with Black communities in LA County. And I remember very distinctly once, many of us who were in, these communities were one day at a rally writing the names, right, of all of the people that year who had been shot by LAPD. And at that time, so many of the last names I knew clearly as we were writing them with chalk outside of LA City Hall were clearly marked SWANA people, but we appeared nowhere in the data. We literally were invisible, our stories, our lives. Those people, I can't tell you how many Armenian names I actually wrote on that sidewalk at that time. And for me, it was alarming to see. When you don't have data, you don't even know the level, right, that something is going on. We know it in our hearts, and it's important to have data to be able to track it so you can prove there's a pattern. Lastly, I really just want to say, there is and there has always been very important SWANA community history around our labor, right? Around that we're workers in California. And so the reflection that I'm thinking about when we do the day in, day out work, right, of people who are just trying to make it and get by, is if we don't have this data, we can't fight for the resources we need, right? But this data clearly proves what areas we need resources from the state. We need to have initiatives to actually close the gaps. It is written, spelled out, clear as day, okay? And in these data points where we are not doing well, we're not just gonna look at them, we have to demand them. I'm gonna leave us off with this. The Count Mina In campaign had such a, I think, really beautiful experience of bringing so many people intergenerationally and across diverse communities, right, who are having to work together in this way for the first time in a very real way, interethnic, interreligious, intercommunity, right, within the SWANA community. And I was really moved when one day we had a Lebanese Arab man in prison, in a California prison, write us a letter and say what it meant to be identified as SWANA and Mina, and how not having that identification in the California prison system impacts his everyday life. And he wrote this to us from prison. And so I want to leave by just reminding us, it's us at stake, it's our lives, it's our futures, and we are powerful and we are brave and we matter. And that's why our data matters, because it is about our lives. And so thankful to this SWANA report. And I want to remind us, as we learn more, it shows us even more fronts or fights that we now have to engage in. And it gives us one step, right? If we find this, wow, I can't believe most of us in this state, especially compared to other communities, are living next to environmental hazards. We need to be on the front lines of the environmental justice movement. We need to connect this, right, to SWANA communities. We need to work and actually ask for things like land justice or how we're going to clean up our communities, right? Have clean air, clean water. It is about helping us in this fight, equipping us. So thank you so much. Our community reflections from the coalition this is such helpful information because it really describes what is happening on our day-to-day basis in our lives.
Thank you so much, Sophia. Thank you so much, Amin. So hopefully now you all have a sense of the type of inequities that the SWANA communities face, the type of data that we have available on race counts. And there's actually a coalition that Sophia was mentioning that's fighting for more SWANA data inclusion that we want to make sure you all know about and that you have a sense of kind of what they're advocating for. So I'm actually going to hand things back over to Amin, who could share more about the Count Mina In campaign and the work that the coalition is working on.
Yeah, thanks, Matt. And I just want to, I want us all to think about the words that Sophia is saying and pointing out, because in many ways that's what this coalition is about, and that's what this campaign that this coalition kind of put together is pushing for, is kind of going in the faces of the community, but also going in the faces of those who write these policies and write these laws to kind of push for the recognition. And so this coalition, is the California Middle East North African Civil Rights Coalition. You can find more information about it on calminanca.org is the website where you can learn more about us. But this coalition that was put together about 3 years, almost 2.5, 3 years now, is a coalition of Middle East North African founded, Middle East North African serving, and Middle East North African led organizations. This group is we are advocate organizations, but also direct service organizations who deal day to day on the field with the community. And we really know the stories. And we've come together to kind of, one, bring our brains together, but two, advance the issues and advance the representation of the community. Because one thing that we genuinely realized was that you can't really bring that advancement without us leading it. So I think one thing to let everybody know and let everybody kind of understand is that now's a really good not now's like our time. You know what I mean? We're seeing our community members literally disappear from the streets, right? Just get taken up and there was a time where during 9/11 we knew that all these policies and all these rules coming up directly impacted not just the Middle East North African community, but the community at large. You know, many people who were misrepresented to think that they're Middle East North African were also disappearing. But now we're seeing a direct attack to our communities. And we're here to kind of try to represent and try to dissuade that. You know what I mean? We're trying to push back against that. So uh, our main objective right now is to advance the representation. We do it through education. We do it through community building. And I really want to emphasize that one of the beautiful things of this coalition is what Sophia was mentioning before. Us coming together a few weeks ago in Sacramento to share knowledge, to share techniques, to educate one another, and also to be the representatives to go in front of our legislators' face. And our main focus right now is to push for that recognition. We're hoping to have mean inclusion passed across the state of California, so that way you can see our communities recognized across all the data forms and check boxes, and we can properly check off our names, which will reflect on that data, and it will help services like that. I kind of put this together alongside Sophia, so I feel guilty if I don't let her talk a little about it and kind of put your 2 points. I see you shaking your head, but I just this coalition really came together for us, just bringing our brains together, but also working together as a group of using our voices and what the power that we have to push through this. So I want everybody to kind of know we're pushing this fight, but please join us. Take action. Tomorrow we have a really big day, so please take action. Follow us on Instagram, but also follow us just through the website. Contact us. One thing I really, really want to push for the community, the SWANA community, is just be ready, because we're pushing it, and get your paperwork ready, get your community ready, because I think we're at the time. We're pushing for it. Get everything ready, because I really think there's good things coming up.
Thank you so much, Amin. So we're coming up towards the end of the hour. Let me close things out before we get to the Q&A. I just want to share the link. So we've been talking about the report. You can access the report by scanning the QR code on the slide right here. We also have the link to the report on the slide. Generally, if you just visit racecounts.org, you'll be able to access this report along with other reports that we have, and you'll be able to dive in deeper into the specific data that we have for various groups, including SWANA. So I'm going to turn things over to Q&A. Also, before I do that, my email address is on the bottom of the slide. By all means, you can reach out to me if you have any further questions, want to partner, want to learn more about race counts. I'm happy to connect with folks. So let me end there. And I think we can go ahead and end the recording, and then we'll jump into Q&A in these last 7 minutes or so. Okay, so I'll look, by all means, if you have questions, be sure to add them to the Q&A.